Imagine this. You're lying in bed at 3 a.m., and suddenly your feet feel like they're on fire. You kick off the sheets, desperate for relief, but nothing helps. Or maybe it's different for you. Maybe it's your hands like 1,000 invisible needles stabbing you over and over again. You've mentioned it to your doctor. He smiled, patted you on the shoulder, and said the two words that make your blood boil. It's age. But what if I told you they're completely wrong? What if the real reason your nerves are dying has nothing to do with age, and everything to do with something hiding in plain sight? Something so preventable, so fixable, that once you learn the truth, you'll be furious no one warned you. And here comes the part that should truly terrify you. The pills you take every morning to stay healthy might be the exact thing that's killing your nervous system. I've seen thousands of patients walk into my clinic believing a lie. They think their nerve pain is permanent. They've accepted it as their new normal. They're wrong. And I'm about to prove it. Right now, inside your body, there are 72 kilometers of nerves, 45 miles. Enough wiring to stretch from New York to Philadelphia. These nerves allow you to feel everything. The touch of your partner, your grandchild's hug, the ground beneath your feet as you walk. Each nerve is wrapped in a protective layer called myelin. Think of it like the rubber coating around an electrical wire. But when that coating starts to break down, everything goes haywire. Signals fail, pain receptors go berserk, and your brain receives scrambled messages that feel like burning, stabbing, and electric shocks. And once this process starts, it does not stop on its own. This condition has a name: peripheral neuropathy. Right now, more than 20 million Americans suffer from it. That's 1 in every 16 people. Someone in your family probably has it. Maybe it's you. But here's what makes me angry enough to record this video. Most people living this nightmare have no idea that a simple vitamin deficiency is destroying their nerves. And the worst part, the medications your doctor prescribed, the ones you trust, the ones you take religiously, are draining this life-saving nutrient from your body every single day. Let me show you exactly how this trap works. You visit your doctor. Your blood sugar is high. They prescribe metformin, the most commonly used diabetes drug on the planet. More than 150 million people take it. You trust your doctor, so you take it faithfully. But you also have heartburn, just part of modern life, right? So you take omeprazole or another proton pump inhibitor. Totally normal. Millions of people do the same. Here's the trap no one explains. Metformin blocks your intestines from absorbing vitamin B12. Studies show that 10% to 30% of metformin users develop B12 deficiency. Some research claims the number is even higher. Meanwhile, your heartburn medication reduces the stomach acid you absolutely need to extract B12 from food. You've created a perfect storm. Your body is being attacked from 2 directions at once. But wait, it gets worse. If you're over 60, your stomach already produces less acid naturally. Aging has weakened your defenses. Add a plant-based diet which contains virtually zero B12. And you're not just at risk. You're walking straight into a nutritional catastrophe with your eyes closed. Your body is begging for this vitamin. Every cell in your nervous system desperately needs it. But everything in your modern life, your medications, your diet, your age, is blocking it. And here's the nightmare that keeps me awake at night. By the time you notice the symptoms, you may already have irreversible damage. That tingling you keep ignoring, it's not minor. It is your nervous system sending up emergency flares before it dies. The numbness you feel today could be the early warning of permanent disability tomorrow. I've seen patients lose their ability to walk. I've watched people lose their independence, their dignity, all because they waited too long to address something entirely preventable. So what is this miracle nutrient that could save you? It's called vitamin B12, and its history is absolutely fascinating. Let's go back to the 1920s. Doctors were terrified of a mysterious disease called pernicious anemia. Patients became pale, weak, and developed horrifying neurological symptoms. It was always fatal, no exceptions. Then 3 researchers discovered something unbelievable. They fed dying patients raw liver. I know it sounds disgusting, But these people literally rose from their deathbeds. The scientific community was stunned. Those 3 researchers won the Nobel Prize in Medicine in 1934. But they still didn't know why it worked. It took 14 more years for scientists to isolate the magic ingredient hidden inside liver. A complex, bright red molecule with a cobalt atom at its core. They named it vitamin B12 or cobalamin. Another Nobel Prize was awarded just for figuring out its structure. Think about that. One tiny molecule so important to human survival that it earned 2 Nobel Prizes. So what makes B12 so critical? It is the master electrician of your entire nervous system. It performs 2 essential jobs that literally keep your nerves alive. 1. It powers methylation. It converts a dangerous amino acid called homocysteine into a beneficial one called methionine. This process allows your body to create SAMe, which is crucial for building and repairing myelin. Without enough B12, homocysteine rises to toxic levels, like poison flooding your nervous system. 2. It fuels energy production inside nerve cells. Each cell has tiny energy factories called mitochondria. B12, especially its active form, adenosylcobalamin, is their fuel. Without it, methylmalonic acid builds up, damaging myelin from the inside out. Do you see what's happening? B12 deficiency attacks your nerves from 2 sides. It stops repair, and simultaneously poisons your nerves. That's why the symptoms are so severe. That's why the pain can be unbearable. And that's why early intervention is critical. Wait too long and the damage becomes permanent. But here's where hope enters the story. If you recognize yourself in what I'm describing, there is a clear path to recovery. But you must be strategic and avoid the diagnostic traps. Step 1. Get the correct tests. Do not settle for a standard B12 blood test. Many labs consider anything over 200 pg/ml normal. That level is dangerously low. You should demand methylmalonic acid MMA, homocysteine. If they're elevated, your cells are starving for B12, even if your basic blood test looks normal. Step 2. Choose the right form of B12. Most cheap supplements contain cyanocobalamin, a synthetic form that includes a cyanide molecule. Your body has to break it apart before using it, and many people can't do that efficiently. What you need is methylcobalamin, or a combination with adenosylcobalamin. Hydroxycobalamin is also excellent. Step 3. Delivery method matters. If you have absorption issues, and if you're older, take medications or have digestive problems, you do. Swallowing pills is almost useless. You need sublingual forms under the tongue, or for severe cases, intramuscular injections, the most effective option. I've seen dramatic improvements within weeks using injections. Step 4. Dosing for real results. Maintenance. 1,000 micrograms daily. Active neuropathy. 1,000 to 5,000 micrograms daily for 3 to 6 months. Step 5. B12 supporting cast. B6, P5P, methylfolate, B1 benfotiamine, magnesium, alpha-lipoic acid ALA. 600 milligrams daily, proven in multiple studies. Step 6. Food is your foundation. The richest sources of B12 exist only in animal foods. Liver and organ meats, clams and mussels, salmon and sardines, beef, pasture-raised eggs, quality dairy. If you're vegan, supplementation isn't optional. It's mandatory. Nerve damage can become irreversible once you cross a certain line. The time to act is not tomorrow. It's now, before you lose sensation in your feet or suffer a dangerous fall. That burning you feel is not just age. It's your body screaming for help. B12 deficiency is a silent epidemic. But it's entirely preventable, identifiable, and treatable. I've seen people regain mobility, sleep, and quality of life. But every single one of them did one thing in common. They acted before it was too late. If this information opened your eyes, I need you to take 3 critical steps immediately.